Today I'm going to be talking about type 2 diabetes and what everybody needs to know to get them through the difficult journey you're going to be on for the rest of your life. This slide represents what's been going on in the United States over the last 24 years. From 1994 to 2008, you can see that the amount of obesity in this country has dramatically increased, especially here in the South. In Florida, almost a quarter of the population is obese. And obese is defined by your body mass index, which uses your weight and your height to come up with an estimation of where you should be. People who are diabetic have also increased. And again, here in the South, just as obesity has increased, and here in Florida, up to 9% of the population is diabetic. Almost 26 million people in the United States have diabetes, and 7 million of those people don't even know it yet. As you get older, your risk of having type 2 diabetes increases, and by the time you are over 65, 1 in 4 people will have diabetes, either diagnosed or undiagnosed. Every 24 hours, over 5,000 new cases of diabetes are diagnosed. We have 180 amputations that are performed. 133 people need to start going on dialysis because of their diabetes. And 634 people die of diabetes, or diabetes is a contributing cause to their death. In 2007, there was a study done of death certificates, and in that study, it showed that 250,000 people had diabetes listed as their cause of death or a contributing cause of their death. Cardiovascular disease in the form of heart attack and stroke kill 75% of diabetics. And if you're a diabetic and you compare yourself to somebody who's the same age and not diabetic, your risk of death, early death, is double. The cost of diabetes in the United States is tremendous. $174 billion is spent every year on diabetes, including direct costs, which is medication, therapy, doctor visits, hospitalizations. And $58 billion is spent on indirect care, which includes disability, time off from work, and premature death. There are two main types of diabetes. Type 1 diabetes is the least common. It affects about 5% of the diabetics. Type 2 diabetes is the majority of our diabetic cases, and that's about 90 to 95% of diabetes. So what's the difference between type 1 and type 2 diabetes? With type 1 diabetes, you have an autoimmune process where your immune system actually attacks the beta cells of your pancreas. And those beta cells are what actually causes you to produce insulin. And if you have your beta cells dying off, then you no longer are able to make insulin. When you have type 2 diabetes, you don't produce enough insulin, and the insulin that your body does produce is not as effective. Your body's resistant to that insulin that you produce. This is just a schematic of normal regulation of blood sugar in the body. Normally what happens when we're in our starved state, like when we're sleeping overnight and we're not eating, the source of glucose for our body is from our liver. The pancreas senses that the blood sugar is dropping, so it actually promotes the release of a hormone called glucagon. Glucagon takes stored glucose in the form of something called glycogen and turns it into glucose and releases that glucose into the blood so that your blood sugars don't drop overnight. That's why we don't pass out when we wake up. Now, if we eat something, then our sugar starts to go up, and that promotes that insulin release from the beta cells. And when insulin is released, it tells the liver to start storing that glucose in the form of glycogen in the liver. And it also helps with glucose uptake from the blood in the tissues where you need it, especially the muscles and the fat. The way it helps glucose being taken up by your cells is that the insulin binds the insulin receptor on the cells, and that actually opens a glucose channel so that the glucose can come on into your cells. And your cells need this glucose for energy. If we don't have glucose in our cells, then the cells aren't going to work right. With type 2 diabetes, you have something called insulin resistance. So your insulin will bind those insulin receptors, but for some reason, genetic, and we don't know all the reasons why, that glucose channel doesn't open up, okay, as much. So you have all this glucose that builds up out in the blood, and it's not getting into the cells where you need that energy. When you have type 2 diabetes, there are 3 reasons why your sugars are going to go up. One is that insulin resistance. It causes your cells not to be able to take up the glucose from the blood. One reason is that your pancreas, in order to try to keep up with your body's resistance, it tries to overcome that by pushing out more and more insulin. And at some point, your pancreas just can't keep up with that, and your pancreas kind of poops out. And you become like a type 1 in some cases, where you just can't produce any more insulin. Also, when your body's starved for energy in your cells, then your liver's going to think that you're starving. So it's going to release that glycogen in the form of glucose into the blood. So all three of these things lead to your sugars being high when you have diabetes. Now, the physiology that I just explained is why we have these diabetic symptoms. When you have too much glucose in your blood, your body tries to get rid of all that glucose in your urine. So you're going to pee a lot. And if you pee a lot, you're going to get dehydrated. If you get dehydrated, you're going to get thirsty. People who are diabetic tend to lose weight, and the reason why is because you're losing a lot of calories in the form of that glucose in the urine. And also, if your body cells don't have that energy source in the form of glucose, it's going to start breaking down muscle. So you do lose weight. Fatigue's a big problem because, like I said, if your cells don't have energy, your muscles won't work right, everything slows down. You can have blurred vision when you're diabetic because what happens is that the glucose actually causes edema or swelling in the eye, so that can pull on the lens so you're no longer able to focus and your vision gets blurry. Your immune system's affected by diabetes. When your sugars are high, your white blood cells, which help control and fight off infections, no longer work properly. You can have more urinary tract infections, yeast infections, fungal infections on the skin. Another thing that can happen is increased hunger. Like I said, initially the pancreas tries to overcome that resistance by putting out a ton of insulin, and you have something called a hyperinsulinemic state. Now, insulin is actually a trigger for hunger, so you actually get hungrier when you're insulin resistant. Your mental status will change when you are diabetic because, again, your brain cells don't have the energy source in the form of glucose. It's sitting out in the blood, but you need it in the cells. So you get confused, you get irritable. Some people can get lethargic as well. You also have some skin changes that occur when you have insulin resistance and diabetes. Insulin is also a growth factor for skin cells. So what you can see is in the creases or folds in the body, you can see this kind of velvety dark coloration. And you probably have seen it on some people. And this is called acanthosis nigricans. It can happen in the back of the neck, in your armpits, in your groin, your elbows. And this is just another sign of insulin resistance. Skin tag formation is another sign of insulin resistance. Again, that insulin is a growth factor for those skin cells. Long-term complications of uncontrolled diabetes. The diabetes affects almost every part of your body. It can cause heart disease and stroke, nephropathy, which is kidney disease, retinopathy, which is eye disease, neuropathy, which is nerve disease, peripheral vascular disease, which is affecting the large blood vessels in the legs and can lead to amputation, skin and mouth conditions, and even dementia. As I said earlier, 75% of diabetics are going to die of a heart attack or stroke. And the reason for that is that you have a couple of processes going on. You have unstable plaque ruptures, and you also can have blood clots that block blood flow. These plaques are basically buildup of cholesterol in the arteries, okay? And what can happen is if these plaques break off, it can actually occlude your blood vessels in your heart and your brain, and those cells can die off if they're not being fed with blood. Same thing can happen with blood clots that break off and actually block the flow of blood to the brain or the heart. You can have the heart attack and stroke. And these cells don't regenerate themselves, so if they're lost forever. Sometimes a diabetic will be put on a medication called a statin, like Lipitor, Crestor, Simvastatin, Zocor. These medicines are really good because they decrease the amount of plaque you get, but it also stabilizes these plaques, so it's less likely that they're going to rupture. And with the blood clots, people are often put on aspirin if they're diabetic because it'll thin the blood out. Another thing to make sure that is controlled is blood pressure, because your arteries will narrow significantly if your pressure is not controlled. In addition, if you smoke, those arteries will also narrow. In the kidneys, you have these tiny collections of blood vessels that help your filtration system. And when you have all that glucose coming in, it actually affects those blood vessels so that the protein starts escaping into your urine. So a microscopic protein in the urine is one of the earliest signs of kidney disease from diabetes. Nephropathy is actually the leading cause and the need for transplantation in the United States for kidneys. Retinopathy is the leading cause of blindness in the United States. This is a normal retina, nice and clean. You can see the optic disc clearly. What happens when you have diabetes is you get these little spots of bleeding or hemorrhage, and you get these aneurysms, which is a weakness in the wall of the blood vessels so that you're more likely to have bleeding. And that's what causes the blindness. Neuropathy is a major problem with diabetes. By the time you're diagnosed with diabetes, you already have a 10% risk of having a little bit of neuropathy, and 50% of diabetics at some point will have even mild neuropathy. So it's an important thing to think about. The reason why you get neuropathy is you have blood vessels that supply the nerves, especially in the feet where you're going to have micro damage every time you walk. Though your feet, your extremities are especially susceptible. And if you have neuropathy, you may step on a tack like this, and because your immune system doesn't work like we talked about, you can get a horrible sore looking like this that will not heal. And the end game would be dead appendages, which have to be amputated. Peripheral vascular disease, as I said, is similar to the process that happens in your blood vessels with your heart and your brain. But if you have a big clot that forms in your leg, or if you have rupture of one of those plaques, then you can have blockage of flow to the rest of your extremity. The other thing I wanted to mention is that you can have skin and mouth conditions. Your dental health is affected if your diabetes is not controlled. You can get fungal infections if your diabetes is not controlled. Alzheimer's is higher in diabetics. Vascular dementia, which is basically when you have all these mini strokes, your blood flow and your blood supply to your brain is affected, so your memory goes down. So that's another thing that you have to worry about with diabetes. The risk factors for type 2 diabetes: the more you weigh, the more insulin resistant you're going to be. If you have a family history of type 2 diabetes, especially with your parents or a sibling, you're more likely to have type 2 diabetes. One parent gives you a 40% risk, two parents gives you 80% risk. African Americans, Hispanics, South Asians, and Latinos are more likely to have, Native Americans are also more likely to have type 2 diabetes than Caucasians. As I showed you earlier, as you get older, your risk of diabetes goes up. Gestational diabetes is another thing to think about. If your baby was born more than 9 pounds, or if you had gestational diabetes, you have a 50% risk of developing type 2 later on in life. If you're inactive, then you're more likely to be overweight. But even irrespective of the weight, if you're inactive, then you're not able to really sensitize your body to your insulin, and you're not able to push that glucose out of the blood into the cells where you need that energy. Pre-diabetes is a state where your sugars are high but not high enough to call you a diabetic. And they estimate that over 50 million people are probably pre-diabetic in this country.